Good morning, good afternoon, and good evening, depending on which part of the world you are logged in from. This is Sumant Timsina from International Development Institute. I have pleasure of hosting this webinar today on PPP and healthcare. And this is our second webinar on PPP. Our first one was on PPP and tourism, and today is on healthcare. And we know that healthcare has been a big challenge around the world right now. Hope all of you are staying safe wherever you are and following your protocol that issued in your own country. And we are expecting a very good number of about 70 people today on this webinar from about 14 countries. So it's it has attracted people from lots of different countries. And it's going to be live on Facebook as well. And before I bring our speakers for today, I'm just going to share a few things on the screen with you guys. So we have done series of webinars recently, and it shows the power of internet, the power of this technology, that how we are even talking about social distancing, but I think we are getting closer than having a distance. You know, I can see our presenter for today, David Baxter and Scott Lacy, their background looks the same. They look like they are from the same room, and we were able to do very successful webinars recently for focus on banking and financial institutions, and we had on for school and colleges, because they have a biggest challenge right now, how to educate children, and just coming on the screen and giving lecture is not good enough. So come up with a lot more innovative ways. And we did on tourism. We have also done lots of different kind of soft skills. And we have a few more coming up. Look out for it, like school administrators leadership. And actually we are going to do this training on the side for 2 countries right now. We are contracting out with them, and we will be training their public and private school principals on how to lead school in this difficult time. And it will be a series of 3 training classes, and there will be on accessible tourism, supply chain management, public procurement, and number of soft skills, leadership, managing people at work, etc., etc. So look out in our website. We will be announcing them soon. And since you have signed up with us, you may be getting some email from my colleagues with these announcements. So if that sounds interesting for you, you are welcome to join it. You can contact us via email, look in our website, look in our social media. And before I introduce the moderator and special guest for today, and also our main presenter. So before I introduce them, I'll just read some of their bio. I'll share bio on the screen and I'll go over that. I'm not going to read the entire bio because I've known both gentlemen very well. So Ambassador Scott Lacy, he will be moderating today's session. And he is a very thorough gentleman, very good mentor to our organization, an advisor for the last several years. And we are privileged to know him for many, many years when he served the government of USA as an ambassador. He has served in the government of USA for over 35 years as a diplomat, working as an ambassador in Uganda, in Eritrea and Nepal. And currently he is retired as a regular diplomat, but he is still a consultant at Department of State with the US government. And he is also an executive director of a very successful charitable foundation called Soulway Foundation. And they are focused on helping people from Nepal recover from earthquake, but now they have picked up lots of other kind of project on capacity building at different level in Nepal. And he graduated with law degree, and he always says that, you know, I graduated with law degree, I didn't know what to do, and I went to become an ambassador. So I wish it was that easy. And here is David, and David has been a really good colleague with us. We have been working a number of projects and building a number of projects together at this point. And David is also a consultant with us, and he's an independent consultant, but he is engaged with us in International Development Institute. And he brings a very broad experience in PPP. I call him a PPP guru here. And he has worked with, we named the organization, whether it's a WHO, USAID, ADB, and different other projects in multiple countries. And I'm glad that he was back in US right before the lockdown was announced, a day or two before that. And so here I present Ambassador Lacy, and he will lead it. Roshan, can you unmute him? Okay, so looks like we have some technical glitch. So I can go to David then, and we start with David, and then Ambassador will pick up later. Is that okay, Ambassador? Okay, so looks like there's some technical glitch. So David, I'm back to you.
Hi there.
Okay.
Thank you, everyone. Good morning, and thank you for joining. It's a great pleasure to have you here. I'm going to talk about the aspects of PPP in healthcare, and I'm going to try and get through it as quickly as I can so that there's enough time for question and answers. So let me just do the screen share and get to my presentation. And let me just, can everyone see? Okay.
Yes, we can.
Okay. So good morning, everyone. I'm going to be talking about public-private partnerships and healthcare. I will touch on these topics very briefly. Why healthcare PPPs? What is a PPP? The different types of, healthcare type PPPs you get. Then I always like focusing on impacts and opportunities, possible strategies, conclusions, some recommended resources that you can look at afterwards, and you will also see my bio. What is important to note is that there are different various descriptions on healthcare PPPs. But Lawrence Carter, who was the head of the PPP unit at the World Bank and now is back at the IFC, in the Handshake series of PPPs, there was a Handshake Health PPP program document. And he pointed out, and this was almost 10 years ago, that governments aren't in the best place always to provide healthcare. And he said what was really important, there was a need for innovative, forward-looking public-private partnerships. And I think the current crisis has proved that this is absolutely true. And as countries try and ramp up their efforts, they were caught off guard. I don't think anyone tried to be bad or manage it badly, but the magnitude and the scale and the rapidity with which it happened has caught governments unaware. And it has pointed out, unfortunately, that many mistakes have been made and also many opportunities have been squandered. I think a good fix for this would be is if strong partnerships were to evolve between the public and private sector to carry things forward. Just this morning, I went to the Johns Hopkins site and looked at the sort of the dashboard that they put out every day, showing the spread and where things are going. And it's kind of scary. A month ago, we didn't even have 1 million. Now we're heading close to 4 million. The United States, we only had a few cases in February, more cases in March. By the time we got to April, it started escalating, but we are at the case now of 1.158 million. And we also face the case of nearly 70,000 cases in the United States. And so the whole issue of containment is a challenge. But what I think the biggest issue is coordinating resources and bringing different parties together. Margaret Chan, who used to work for the World Health Organization, says, we need to find ways to strengthen healthcare systems. And it says, we are faced with the absence in many situations of efficient and sustainable systems for service delivery. there was in the IFC document, it was almost prophetic, which was, as I said, almost 10 years ago, the document was put out. It says governments worldwide are struggling to meet these, to meet demands and challenges with limited fiscal space, but simply lack the resources to provide healthcare to their citizens. And this is a reality. It's not a political thing. It's not a dogmatic. It's not a paradigm or anything like it. The reality is that we are facing a situation where it's become evident that governments don't have the resources, and yet there are private sector resources that could be leveraged to help improve healthcare delivery. I think we have to swallow our pride a little bit now and decide, how can we be pragmatic, innovative, and how can we leverage the best resources of both the public and private sectors to provide healthcare, because people are dying. It's interesting also that, the IFC handshake in 2011 stated that low-income countries can and start very ambitious programs. I think in partnerships, I agree with it. The other problem is that many PPP contracts and healthcare PPP contracts are not necessarily complete, because they are events, and I'm sure you've heard of the term force majeure, which can bring about dramatic changes that people weren't expecting. And not just COVID-19, but other events as well. And there they list, their technological challenges, demographic challenges, managerial, political. And so this is, something we really have to sit up and take note. But I think, or I firmly believe, I don't even think, that COVID-19 has created a situation where we have become acutely aware of these shortcomings. And it's important, especially that they say, and the handshake said this, that innovative healthcare PPPs can play a vital role in quickly upgrading infrastructure, health infrastructure and services in regions scarred by natural disasters or wars. And I think, we are currently in that kind of stage. We're not in a war, but COVID-19 is in essence a natural disaster. And we have seen this in countries that have managed to control the events and do pretty well. They have moved forward because they have fostered partnerships between the public and the private sector. So, what is a public-private partnership? A lot of people get confused. There's a wide range of them. Sometimes people call public-private partnership actions, which I really consider more just philanthropies, where, the Gates Foundation or etc. form partnerships with the public and the private sector, or the public sector, to provide services. And in a way, it's a public-private partnership, but it's short-term. And these actions are not always sustainable or resilient, because as soon as the donor or the grantee goes away, these projects end. When I'm talking about the type of PPPs that I would like to talk to you about today, I'm talking about formal PPPs. And these are direct, contractually bound partnerships between the public and the private sector. So it's not just a feel-good thing, it's a contract. The periods of time can be extensive. They can be up to 30, 40 years long. Where I live here in Virginia in the United States, there was a PPP that was signed for 99 years. It sounds crazy, but these exist. But what is happening, it's a partnership where the private sector decides to take on some of the risk. It manages the project, whether it's a service or infrastructure, and then it is rewarded according to its performance. The United Nations Economic Commission for Europe, UNECE, also points to the way PPPs or why PPPs are so great is because they introduce innovative methods where the private sector can bring their capital and ability to projects. And we are seeing this in the United States. The pharmaceutical companies stepping up and saying, we will deliver vaccines, and we're not going to do it for profit, we're doing it for the common good. But also in the long term, there are those where there is a profit aspect when you have PPP hospitals and clinics or services. And I would just like to point out that profit is not a bad thing in PPPs, because profit allows good service. And companies that are allowed to make a profit, if they are well monitored, will provide good services because they're incentivized to perform. there's just a very wide complexity, and I have to show you this. This came from the International Finance Corporation in the document of 2016, but you can see the wide variety of services that can be included in PPPs. When you go to hospital, they could be non-clinical services. You can see those there. Then you have specialized clinical services. There are a lot of dialysis PPP services, for example. A country that did a good project in that was the Philippines. Clinical support services, hospitals and health networks, ambulatory care, and then the full concession. So that's just to give you a sense of the variety of PPPs that are out there. The other is just to show you a very simple diagram that talks about some of the models. You might have heard of franchising, but I think most people have heard of design, build, finance, operate, build, own, operate, transfer, buy, own, lease back. These are variants of PPP models that can be used in healthcare. All that I just want to point out is that every PPP project is unique, and you should try and design a model for the PPP project. Don't try and force the PPP project into the model. And as many bright people are there are as many descriptions of these types of models. I did accounts once, and I think I gave up and I got to about 60 different variations. So again, it's very simple. It's a partnership between the public and private sector to provide a service or a facility. In this case, it would be, clinical services, medicines, whatever, or to run and operate a hospital. There's another version here that you can look at another time, but there are examples here of different countries. In Brazil, they have had imaging diagnostics. India, specialty hospitals. I'm not going to go through the full list. Egypt, maternity hospitals. Mexico, just 2 hospitals there. Canada, it goes on. And the Canadian government has one of the most extensive, what would you call it, PPP healthcare systems in the world. So does Turkey, if you are ever looking for countries to look for examples. But they work, some well, some a little less well. And again, I say it's important that monitoring takes place. So here we have a situation where we have a wonderful set of examples of potential collaboration between the public and private sector to provide healthcare. There's some more. I'm not going to read these all, but you can just see it's just another slide there showing an example. If you look at the bottom right-hand corner, you can see one of the United States naval hospital ships. I don't know if you were aware of it, but 2 were sent to 2 US cities. The most well-known was the one that was sent to New York as a backup. That was a government-run facility. Obviously, it's a government facility, but it was a way that there was a collaboration in the United States between healthcare, which is largely privatized, and then the governments as well. Just some of the things that you have to look at when you're looking at projects, and this is also from the IFC Handshake article or document that I've referenced. You can see some of the key assumptions for hospital PPPs. It's a long-term contract. Hospitals, which are the top range and the most sophisticated of PPPs, are going to require a longer period of time, 25+ years. A clinic, you might be able to do a 5-year PPP. There's got to be upfront capex and subsidies. There would also be annual payments. In some ways, the operator of the hospital can be totally responsible for gathering the revenues and paying for paying off their debt with those revenues. But in many cases, most hospitals are run with sort of an availability payment set up, where for every patient that comes in, the government pays a certain amount. Usually those are tied to national healthcare insurance schemes. But this is just very interesting. You can see some of the breakdown that operating expenses typically can be about 50%, debt services 17%, equity returns 16%, and in maintaining the capex at 10%. So there are many moving parts we should address that provide potential and opportunities for healthcare. They are the supply chains. These could be improved, which are also producing protective clothing, medical equipment, instruments, pharmaceuticals. And if you've listened to the news, this seems to be one of the areas where we've gotten to the biggest trouble. PPPs, protective clothing, medical instruments, pharmaceuticals, medications, ventilators, all of these have we've struggled to have enough of those to protect staff and to help people get well. There's also these are more of the long-term versions activities that will have to be expanded and improved. We're going to have more labs. Hospitals are going to have to be encouraged through partnerships to have a standby backlog, you can say, of emergency equipment in hospitals in case there's another outbreak. And many people are predicting that it might be back here in the fall in the Northern Hemisphere. And then there's also the healthcare practitioners that you could do agreements. For example, the hospitals in Turkey, the operators run the hospital, but the healthcare providers, so the actual nurses, doctors, and that remain employees of the state or the government of Turkey. But we have found out, unfortunately, that there's a greater need for resilience. And what are needed are partnerships between the public and private sector that will address short-term, medium, and long-term challenges, and I'll address those now. But I think it's important, it's really important that as we address the issues in a short-term basis, that we find ways to fix challenges or mistakes that we've made or problems that we've identified. We need to catalog these. We need to make lists so that they can then form the foundation of medium-term actions and then long-term actions. And ultimately, long-term challenges or actions that need to be considered now for PPPs all over the world it should be heavily focused on sustainable practices, resilient practices, and regenerative practices. And by regenerative, I mean that hospitals should be constantly updating themselves and be relevant. There's a big challenge with the technology we use in hospitals and a big fear and a challenge when it comes to obsolescence of technology. And this can be addressed by public-private partnerships because the public sector is more likely to implement technological innovations than governments are. So we should be looking at building a whole ecosystem. So what I want to say is that the longer the commitment in a PPP partnership, and I mentioned this early on, the more formalized the relationship between the public and private sector. So all the good philanthropic things that we are doing now, where organizations are pumping hundreds of millions of dollars into research in it, that's great for the moment, sorry, but it is short term. We have to decide, are we going to build new hospitals? Where are we going to build them? Are we going to build facilities to store equipment? In centralized national healthcare systems, which are private, which are owned by the state, for example, like in the UK, or mainly in Turkey, for example, we have environments where the public sector generally runs the healthcare system, but now there's an opportunity, I believe, for the private sector to be a meaningful partner and to back up the healthcare systems. In the opposite, in the United States, where we have the privatized healthcare system, which has been overwhelmed, and hospitals, have struggled, this is a chance for the US government to form relationships, maybe through the Veterans Hospital System, Department of Defense facilities, in case of national emergency. So it's a two-way thing that could be looked at depending what type of healthcare system you have in your country. But the most important thing is we need government-led coordinated relationships. This can't be haphazard. And in the United States, it's a bit scary that every state has been left to its own devices instead of focusing on a national strategy. So in the short term, I just want to talk briefly about some of the short-term stages or actions that we can take place. We need to be encouraging informal philanthropic partnerships now. But as I said, we need to move on after a while. We also need to focus heavily on improving supply chains. And this is where the private sector could be incentivized. There'll be a number of cases that we have seen on television, for example, under the War Productions Act, where supply chains are being improved because the government is encouraging or even in some ways co-opting the private sector to provide critical services. We need to promote collaborative actions here where I say the national and subnational government agencies collaborate, not what we're seeing here in the States where different federal agencies are grabbing supplies from state agencies that have ordered them and said under the national emergency regulations, they're allowed to grab for the greater good, and then they leave the states high and dry, or vice versa. We also need to improve digital infrastructure, and this is going to be important because unless we can track information, we are never really going to know where the spread is. And I think this is an ideal example or an area where public-private partnerships between the big tech companies and government could be fostered. Another thing is also known proprietary solutions. We do need to find a situation where if governments and the private sector are collaborating and they're cross-subsidizing and billions of dollars are being involved, that it doesn't become something that one party controls and then expects tremendous amounts of remuneration for that. Another thing we've seen constantly is relaxing unnecessary bureaucratic red tape. PPPs take a long time to set up. And as we move forward from the medium to the, from the short term to the medium to the long term, if there are critical healthcare PPPs that have been identified, it is critically important that we look for opportunities to find ways that it's easier for the public and the private sector to enter into PPPs. A typical PPP can take up to 2 years to process. We don't have 2 years. And then I said also having an index of lessons learned. Now in the 1 to 5 year time frame, just some examples of ideas that I think are important. We need to look at brownfield PPP projects. I've read and seen on television a lot about existing facilities that had been mothballed because there wasn't a need for them being reactivated. Maybe this is something where governments and the private sector can look at re-establishing or reactivating hospitals. We also need to explore binding agreements between suppliers and consumers of medical equipment and good to build medical stockpiles. And the idea that I've had is, we've found out that the distribution points have struggled. Maybe it's time that somebody explores emergency warehouses where the suppliers of medical goods can be encouraged to store many of their products in centralized warehouses. And it's sort of a flow through area. It goes in the one end and it goes out the other, but you build in sort of a period where there's maybe at least a 3-month supply in available medications, equipment, etc., so that you always have this backlog. And this could be explored through a DBFOM type model. I think there's also, the mitigation. We need to mitigate technological and pharmaceutical obsolescence. It seems we've really been caught offhand on this side. It was disturbing, I thought, when we found that the national organization that, I can't remember what it's called, but the warehouse set up by the military to keep equipment for national emergencies, when they started distributing ventilators, they found that many of them didn't work and were antiquated. We can't allow that to happen. I think the private sector could be incentivized to run these places, these storage facilities, and ensure that all equipment is up to date. But it's important that we have collaborative, harmonized, and cohesive research and development activities for all parties. We'll go to the next. Longer term, 5 years plus, I think we need to start looking at the idea and understand the idea that pandemics don't recognize borders. And we've seen this. It started in China, it exploded in Italy. There's a big debate of where it came from, but it came from all over the world and everyone infected everyone else. So we need to look at strategies to work on this. There are international organizations that could be involved. Even, the World Health Organization, NATO, you can go down the list. There are many bodies that all have healthcare strategies. They should find ways to coordinate their priorities. I think it's important that at first countries should look at prioritizing their national national priorities, but it's important that they should also consider international priorities as well. Because unless we go into total lockdowns forever, we are never going to be in a situation where we can how can I say it, where we're going to be safe. So just in some conclusions, I think governments need to establish these healthcare procurement platforms that I've talked about. Maybe it's necessary to have legislation such as the War Production Act until we are in a safer time. I think also important if people are considering unsolicited proposals. This is where private sector goes to the government and says, boy, we've got a deal, an idea, an innovative process which can help things. And these projects are being considered for procurement in a rapid speed or rapid paced process. It's important that there should be every effort made to ensure that they are not unscrupulous players, because unfortunately that we've seen as well. People selling products that are defective, people have been hoarding, etc. And this is not something we can afford. I just want to end off with a very interesting story. I was speaking to a friend yesterday in Cape Town, South Africa, my home country. And it was interesting, and she has 2 young sons. They are like 21 and 22. they decided that they had 3D printers, and they had started, think, gosh, we can make face masks for COVID-19. And they started making face masks. First, they made it for their friends, then they made it for their, their family, then their friends, and then acquaintances, and it took off. What's interesting, though, if you look at some of the exorbitant prices that have been charged, here they're only charging 50 Rand for a shield, like you can see here, which is the equivalent of $2.68 versus the 15, 16, 20 crazy dollar amounts that you've seen. And it just amazes me that if there are people who can innovate and print face masks and shields like this, and they can do it from their basement, essentially, why can't governments do it? So, we need to wake up. We need to form these PPP partnerships that are innovative, use new technology, and we need to, I think, blur the boundaries a little bit between the public and the private sectors for this specific case. I think the public sector has to think more like the private sector, and the private sector is going to have to think more like the public sector. And so just, some conclusions. It's critically important that if we're looking at failing projects that are healthcare projects, which are PPPs, we cannot let them to fail. It's not an option. If they fail, it's going to place people in dire need, in danger of health. And we could find ourselves that we would be in a situation that would take forever to reinvigorate or restart their projects. It's critically important that all projects be competitive and transparent. We need to consider force majeure requirements. And by that, I mean, you don't just blame one party and expect them to bear the cost of force majeure. No matter who's responsible for the force majeure requirement, whether it's the public or the private sector, if either party is unable and it's going to result in the project failing, both need to step up. It's better to ensure that they are successful. So we need to look sustainably. We need to think resiliently. We need to also have projects and PPP procurements for health in the future that are going to be flexible and ready for the next force majeure health emergency. I don't think that we can sit comfortably and just hope that these are never going to happen again. I'm convinced that we are going to have repeats. They're talking about a second wave, but I've even heard scientists talking about a COVID-21, a COVID-25. And until we have vaccines that work and we have robust systems, every effort should be undertaken to ensure that these challenges are addressed. And the best way to do it is between public-private partnerships. For those who are interested in reading, just over time, I have written a number of blogs, some of them being carried by the World Bank, some on LinkedIn, but I think you would find these very interesting. One is about proactive healthcares in the coronavirus. Procurement is important, exploring that. And then also the whole idea of pandemics, PPPs, and force majeure. I don't think we have thought about that enough. So I believe that that's the end. You heard about my bio as such, but if you ever want to reach out to me, there's my contact information. So I'm going to stop sharing and I'm going to hand back over to Suman and his team. Thank you very much.
Ambassador, all yours.
Thank you, David. Suman, am I on? There we go.
Yeah,
David, thank you very much, and apologies to everyone for the technical glitch at the outset. Yeah, my computer froze, and there's nothing much you can do but reboot and try to rejoin. But it's not that much different than being late for a meeting due to beltway traffic in the Washington, D.C. area. So we'll pretend we're in the old world, and that's what had happened. David, thank you for what was really a fascinating presentation. This is such a unique time for all of us. And please let me digress for a moment and say, please submit your questions. We're going to turn to questions in just a moment. But to just kind of frame this, right now we are dealing with this unprecedented pandemic that none of us have seen anything like this in our lifetime. And we're so consumed with that problem set. But for all the challenges that it poses, it also poses great opportunities for us. Great opportunities for societies across the globe to rethink how we educate, how we engage, how we do business, what we are going to build for the future. And David has talked about what we can do to change how we're addressing these issues of healthcare as we look down the road. And although I think he's absolutely right that this isn't a one-off, we're going to see this again in the fall. There will be future pandemics, there'll be future challenges. But it's more than just about pandemics. We know that in the United States, and I think in many countries around the world, we're looking at this question of how we do healthcare delivery, how we meet the fundamental needs of our societies. And certainly in the US, we recognize that we've got to make some really significant changes, and we aren't getting it right. And we've got to figure out what the future is going to look like. And this is the time to begin to think creatively about these sorts of public-private partnerships that can be truly transformational. There is no question that right now we face huge challenges in terms of the supply chain, in terms of service delivery. I was listening this morning to them talk about the need for 30 million tests a month if we're going to effectively reopen the economy in the absence of a vaccine. 30 million tests a month. The public sector isn't going to do this all. We are going to need that public-private partnership in terms of supplies of tests, in terms of point of service testing. All of these things are tremendous opportunities, but they're also tremendous challenges. It's not going to happen overnight, as David said. This will take some time. And this is where, again, we have to look not just at the current emergency, but also at what we are trying to build for the future. And we know in America, and I think this may be true elsewhere, but in the United States, the federal government's ability to meet the needs across the nation is stretched right now. President Trump has suggested to states, you're on your own. We have cities that feel that they're on their own, that increasingly they need to find their own creative solutions because they can't always look to the federal government to bail them out. And David, I couldn't agree more that it would be great if we had an overarching vision at the federal level, rather than a disjointed 50-state approach. But at the same time, if municipalities or states can find ways of addressing these things, that may be what we're going to see. We see a 7-state alliance led by Governor Cuomo with some of the states in the Northeast, who are trying to find more effective ways of dealing with this. So the field is open. There are tremendous opportunities ahead. And you had mentioned that this has to be more than just philanthropic engagement, and I agree. Right now, I was talking to a colleague at Dell Computer the other day, and they wanted to do 3D printing of face shields. That's great. And that was a gesture they wanted to help. And I put them in touch with some colleagues at Mass General Hospital. They've got a Center for Innovation and Partnership with the private sector. And that's a beginning, but it isn't the sustained contractual for-profit, and there's nothing wrong with that, approach to these problems that we're going to need. The last thing I'd say, and David, I guess let me pose this as the first question, then I'm going to turn to what others have submitted. As we do this, at least in the United States, we have a growing suspicion, if you will, of the private sector, a real concern about corporate profits, inequitable distribution of wealth, a lot of concerns among average citizens about how this would look. And I think there'd be a concern that as we see these partnerships evolve, that somehow these big companies are going to come in and abuse the process, abuse the system, take all this money out and not give us enough in return. So in terms of transparency, accountability, and building a relationship of trust, do you see that as a challenge, or is that something that we can more effectively address as we go forward?
It is a challenge. But I think what is really important is, I think, to understand we don't really have an option. And so what happens is that, procurement officers, for example, if it's from the public sector side, are going to have to understand these partnerships better. They're going to have to understand what they want. And there's no better way to articulate that better than giving very clear desired outcomes. And this is going to take place, when not now, when everyone's in panic mode, but in like the 5-year, the 10-year, the 15-year time frame, where we can learn lessons, we can find out what the gaps were, and we can start smart, I would call it smart procurements. And in that way, it would, I think it would take away some of that fear that the corporations are just going to grab everything, because if it's very clearly articulated, these can be turned into transparent, and transparent is only going to happen if the information is out there, competitive, if everyone has the opportunity. We should not have this situation where, special dispensations are handed out to people because of their political connections or their location or whatever. We also might have to break down some of the nationalistic boundaries that we have, that if you are looking for a system and there's another country and there's another company in that country and it produces something better, cheaper than your own country can do it, swallow your pride. It's all about saving people's lives. It's not about, saving, I don't know, face, if you can call it that. So I think, innovation, understanding what you want, having desired outcomes, transparent, competitive procurement, and then one thing that people forget all the time, monitoring and evaluation of performance, ongoing. So the public sector should not just say, here's the contract, build us 100,000, whatever you call it, ventilators. They need to monitor them while it's happening, that you don't have 100,000 ventilators on the market that don't work.
Sounds good, David. Thank you very much. I'm going to turn to a question that we received from one of our viewers today. This question, do PPPs work differently in countries with national social insurance schemes? And also, can you share your experience or examples in the Middle East and the areas of services where it was applied?
Okay. Yeah, so I think, as I said in my presentation, or I hope I said it, that every PPP project is unique and you've got to take local and situations in consideration. In countries that have a national healthcare insurance, like in the UK, that's a different type of project, because I think the risk of payment is going to be considered to be less by the private sector, because they know that the national healthcare insurance is going to pay sort of an availability payment or a fee when this happens. In countries that don't have it, where you rely almost exclusively on the private sector to provide it, there are challenges. So this is something that I think we have to look at very carefully. But I just firmly believe that PPPs are going to be the future. We just don't have the capacity or the broadband or whatever you want to call it, especially when it comes to, governments as they are trying to, meet their sustainable development goals, for example, the 17 sustainable development goals, and one of them is health to everyone. It's just not going to happen if the public sector does it on its own. And this is where the private sector needs to be drawn in. And just, it depends on countries. I've worked in countries, I worked in Sri Lanka, for example, which is called the Socialist People's Republic of Sri Lanka. So they have a socialist approach to many things. And there's a sort of a suspicion of PPPs. Yet then you asked me about the Middle East, where, I've worked with the Ministry of Health in Saudi Arabia and some of the hospital systems there. And there are, I think there was, maybe the oil prices have affected that amount, but there was a tremendous consideration of pumping in state dollars into helping these projects and forming partnerships. But I think which impressed me the most in the work that I did in Saudi Arabia, for example, with the PPP unit that they have there, was that they were emphasizing that we want to do healthcare, but we want to do it well and correctly. And this means sustainable and resilient healthcare projects. And so they were putting in measures to improve the enabling environment, the legal frameworks, etc., to entice the private sector to participate, but on a situation where not all the risk was put on the private sector and the government had none.
Yeah, I think that's fair. And a lot of the challenges too, when people have these concerns, and we've seen I've worked in countries where corruption, for example, was such a pervasive problem, and people were deeply concerned that no matter what happened, people were going to be dipping their hands into the till and things weren't going to work out right. And that's a legitimate concern. But that goes to the fundamental nature of governance in those countries. It's not necessarily something that's inherent in PPP. And if we're going to address these things in PPP, we have to address them in broader society as well. And I hope people will, but we shouldn't discount the idea of building effective public-private partnerships just because there are issues in some nations with the quality of governance and control of corruption. We have another question here that is interesting. What is your experience with costs and outcomes of PPPs against traditional procurement in healthcare?
Yeah, okay. So there's a bit of a myth out there that PPPs can be cheaper than traditional procurements. At times they are not, because they will be provided by the private sector, which has its interest in making what I would call a fair profit. And the public sector doesn't make that. The public sector also doesn't tax itself, etc. There are many things that then cause a bias towards the public sector being able to provide it, or being able to provide it cheaply. But the question is, can they provide it better? And one of the number of things that have to take place, I think, with healthcare projects, and these are the longer term ones where they're going to be building big infrastructure, is, many of you might have heard what they call the public sector comparator, where you take a look and see what the public sector, what it would cost them to do it. Then you have a look at what the private sector could do it, at what cost they do it. In many cases, it's more expensive for the private sector, but then you've got to address things like what they refer to as value for money. Are we going to get the value out of this? And if you're going to have a slightly more expensive hospital system that's being run by private sector operators, but it's doing extremely well, versus a moribund, collapsed national healthcare system that is just terrible and you essentially go to the hospital to die, which is in many countries, I think the choice is pretty clear there.
Thank you, David. A number of folks are asking some questions about your thoughts on what is the future of this pandemic, both in Europe and in the Middle East in the coming months. And I know you're not a medical expert per se, but this is what's on everyone's mind, of course, at the moment. But in addition, there is a question that said, beyond what happens in the next few months in these different regions of the world, what do you see of the future of PPPs post-pandemic? And that's something we were talking about too, that there is that need to look beyond the immediate crisis and to see if we're going to see a transformation in the healthcare delivery system and the supply chain worldwide in the years ahead.
Okay, that's a good comment. I'm glad that question was asked, because it's not all about COVID-19. It's about providing robust, resilient healthcare systems to countries. The flavor of the year, if you want to call it, is COVID-19. What's it going to be in the future? Now, many countries are facing their sustainable development goals and they have unique challenges. I know, for example, in the projects that I was supporting in the Middle East, two big problems that were standing out there, or three actually: an aging population, a population that was suffering from diabetes, and a population that was suffering more and more from heart problems. Mm-hmm. So the result was that they were looking at, reorganizing, redirecting their healthcare systems to looking towards the aged, towards diabetics, towards obesity, towards people with heart problems. And so, that's just an example of, we have to have flexible PPP agreements. My biggest concern is, and I think governments have to be very careful about that, if you enter into a 20 or 30 year or 40 year or 50 year, no matter how long it is, PPP project that is absolutely focused on one type of service, we don't know what things are going to be happening in 10 years, 20 years, 30 years, 40 years time. Is your PPP project flexible enough that it can adjust to the changing demands? Because if it doesn't, you're going to be sitting with a project that has what you call a diabetic hospital that has no diabetic patients, because, who knows, we might come up with a cure for diabetes. So I think this is the type of thing. So if we go crazy and we build just COVID-19 resuscitation centers and hospitals, does that address the long-term strategy of what we're looking at? So again, those ideas of sustainability, resilience, and the word I used, regenerative. Can we regenerate these facilities to address new challenges?
Well, Dave, thank you. And, it reminds me when I was ambassador in Nepal, one of the things we focused on so closely was disaster preparedness and risk reduction and mitigation. And yes, we focused on an earthquake, but we also recognize disasters take many forms, and medical challenges will take many forms as well. It was the same sort of thing I worried about in Uganda, where we knew that the next major pandemic might emerge from that Rift Valley at any moment. And we had to think about, how do we prepare for the future? And it's not just one specific problem set, but building resilient systems that are capable of responding effectively to a wide range of challenges. And that's what I think we all seek to do. There's another interesting question here. It was something I was thinking about as well, actually. And as we look at this question of PPPs, some folks are going to say, well, how do we do this? How do we begin this? Is it for the government? Is it for the public partner to initiate and to lay out an idea about this is what we need and ask for bids? Is it for the private partner to come forward and go to the public sector and say, hey, this is what we can provide to you. This is what we can do. And the question specifically here is, how can we start this PPP healthcare program in Nepal through a local NGO? What are the things we need to start? How do we? Yeah, the concept is great, but how do we turn the concept into reality?
That's a good question. So I think, the public and the private sector have been siloed, essentially. This is my territory, this is what I do, this is your territory, that's what you do. And they haven't had these cross conversations. I think what's going to be critically important, if governments are really going to focus on improving healthcare, resilience, and they set specific goals, based on maybe for their sustainable development goals, that they're going to have to do more and more market outreach. Now, it's interesting that I've worked in many countries where governments have launched PPP programs, and not just healthcare, but in other things, and they've felt very strongly about it. They have gone and, they've gone through a whole expensive, lengthy procurement process, and they put the procurement on the street and no one bid on it. You don't want to have that situation where the decisions are made in isolation so that it's not appealing to the private sector, for example, to participate. Inversely, it's also important that governments need to be receptive to great ideas that come from the private sector. And the reality is, whether we like it or not, big research hospitals that might operate a bit like NGOs, the private sector, which are not NGOs, but they are the source of much of the research and developments taking place, have innovative ideas, they have great ideas. And I think an environment needs to be created where there's mutual trust and respect for both parties, where they listen to one another. So there should be procurement conferences, for example, before you get down into the weeds and then no one bids. There need to be, market outreach programs. And I can tell you the countries that are the most innovative and that are the most receptive to private sector insights, and that are going to be the ones that are going to recover quicker, because the reason is that investors, developers, people with great ideas are going to go to the countries that want to do it. Investors are not sentimental. So if one country does it badly, they're just going to say, well, it's not worth my effort, I'm moving on. And then that country should not be surprised. And so I think, what's going to happen, and this is where governments need to be very careful in the next year or two, is looking at how they treated the private sector, because that will determine the type of relationships that are going to take place. And people have long-term memories. And if they were forced to go insolvent because the government wouldn't work with them collaboratively on rescuing a PPP project, for example, and this becomes the norm in a country and this becomes well known, that country has just shot itself in the foot when it comes to using PPPs for the future.
Yeah. Thank you, David. We've got about 5 minutes left. And questions keep on streaming in, but we're going to hit it. I'm going to combine a couple of them here. I will just say to our colleague from Bangladesh who asked about corruption in the healthcare sector, we've already touched on the issue of corruption. And again, these are fundamental issues of governance that I think are beyond the scope of what we're addressing today, but that societies have to find a way to tackle. Because if you do not, whether you've got a public-private partnership, whether it's government run, however you're delivering these things, it's not going to work. But there are some a combination of interesting questions here that ask about, is there a difference between the way you see PPPs played out and working in developed countries and in developing countries. Where can you offer some examples of where you've seen some really beneficial partnerships, especially perhaps in the developing world? One of our colleagues in Pakistan was wondering how it might play out, for example, in their country. And so this question about developed and developing world and some examples of what you've seen work might be helpful to our colleagues at this point.
Yeah. You know, I think both have their strengths and weaknesses. You know, the thing that's always alarmed me the most, and we see this specifically in the United States, is that developed countries, I think, are extraordinarily expensive when it comes to healthcare. And that then makes PPPs extraordinarily expensive. And so, you know, it seems to me that in a country maybe like the United States, where we really wouldn't have healthcare PPPs, but we could have collaborations in the future, you know, cost is going to be an element because we might get very little done with great cost. However, I have seen in developing countries which have a focused strategy, they have developed strategic pipelines that are focused specifically on needs and not just let's get everything from every direction. They are ones that are creating projects that are offering value for money, that are bankable. They're not prestige projects. How many fantastic world-class heart hospitals do you need, or cancer hospitals, when you're not doing anything with primary healthcare? And I think in developing countries, if they could focus more heavily on the preventative type of healthcare projects for PPPs, they are going to get a better, you know, bang for their buck out of it that way than if they just focus on extreme prestige hospitals. I think the one thing that's critically important also in emerging economies is to look at how would you call it, dispersed healthcare systems. Don't build just one big national hospital in your capital city that no one can get to. And that means that, you know, the scale and the type of PPPs that are going to be considered are going to be less. So, you know, in the West, you know, I think in Turkey, it's like almost in the West, they developed a hospital system where they built 27, I think it was provincial PPP projects that were worth billions of dollars. But Lesotho, I remember, did a PPP project with the Millennium Challenge Corporation, where they focused on local clinics in the little, in the different sub-regions of the country. And so it's a matter of scale. I think what's important also is that if you're doing smaller projects within your country, try and get domestic investors to be involved. You shouldn't always reach out to international investors because the smaller scale projects are not going to be that attractive to them.
Thank you. Now we're nearing the end, but I'm going to throw out one more question at least. And for those whose questions we don't get to, I would suggest, and I would hope that perhaps you can reach out to our colleagues at the International Development Institute for additional follow-up. One of the additional questions, though, that we've got is what are some of the preconditions for PPPs being a good option? For example, the rule of law and political stability. What's the minimum level of development? And now this ties in a little bit to what you just were saying. And what measures do you look for?
Okay, so I think first of all, it's important to develop the institutional capacity of the procuring agent. Many PPPs, unfortunately, when they are procured, they're procured by procurement agents who know nothing about PPPs. So this is where it can go wrong. So strengthening institutions, both at national and subnational level, that are going to launch healthcare PPP programs is critically important. And this will be specifically important for the healthcare ministries in those countries, so they know what a PPP is. Second of all, I think the enabling environment is critically important. And by that, we mean the legal framework, the laws, the best practices. If they are not investor or private sector friendly, you need to revisit those because investors, whether they're healthcare or anything else, are not going to come in. I think it's also important to look at ancillary services that are also related to healthcare, like water and sanitation. You know, it's no good just building all these hospitals, but if you keep on packing up with people who are suffering from chronic diarrhea and cholera and whatever, hepatitis and that because of poor sanitary systems, you are wasting your resources. I think also important is better planning, better strategizing. But to me, and I've worked with governments helping them, the most important aspect of when you're doing a procurement, well, there's two actually. One is clearly articulating what you need and what you expect, so that when the private sector signs that agreement with you, they get on with doing that. And the other is having clear evaluation criteria so that you can choose the best partner. If you can't do that, you shouldn't be even entering into a partnership, because you're going to have misguided, misinformed people with opposite expectations, and your whole project is just going to be under stress from the beginning. And the risk, I think now is the time that we look at risk and decide, how do we allocate risk in projects that is going to ensure the sustainability of the project? And are we willing to adjust? And finally, I have maybe too many answers to this, but I think what's important is that the private sector, if it enters into a partnership with the public sector, should feel comfortable to be able to say or tell the public sector if something's going wrong without the fear of an immediate punitive action against them. Because if we can't open up the communication channels and people can share challenges, opportunities, ideas, solutions, we are just going to be doing PPPs the way we've been doing them, in many cases, badly.
All right, David, I'm going to prevail upon you for one last question, because Suman hasn't told me I absolutely have to stop, but then we are going to stop. But I think it's another important question. And it goes, you mentioned risk, and the perception of risk can have an impact on financing. And these can be expensive propositions for the public sector partner to engage in. Not all of them may have the resources. And so the question is, how has been the response of financing institutions and banks to lending to support PPP healthcare, especially in working with the public sector partner?
Okay. Talking about the Middle East, there seems to be a great willingness to do that based on the country's approach to healthcare PPPs. So, I think in the past, in the Middle East, maybe in Saudi Arabia, for example, healthcare was very much the purview of the state. And, if there were situations with healthcare projects, they were partnerships, but they were more, I wouldn't say public-private partnerships as well. But as Saudi Arabia realized that it had these health issues that were increasing and their revenue from oil was declining, they started making concessions to the private sector, and they didn't put all the risk on the private sector. I think what's critically important is that all parties understand when they're talking about risk, what they're talking about, and are they using the same language. I once was in a situation where I had public and private sector people, and they were talking about risk, and they had no clue that what the other party's perception was of risk. So you need to come up with uniformity of those descriptions. I think also, there's a tendency to focus heavily on risk that scares investors away. Pare down your risk profile of a project to things that really matter and really make sense. If you put 500 risks out that you've identified, you've killed the project. If you put out 300 risks, you've killed the project. But if you come up with 50 concise risks that can be managed, that are allocated to the appropriate parties, and there's a strategy for mitigation, those projects are going to be acceptable to investors. And as you said, the higher the risk, the more risk there is for higher costs. And then just in the last, if you have major risks and projects almost look like they might be uninsurable, which is going to be a big challenge, is how is the insurance industry going to face these? Reach out to organizations like MEGA at the World Bank, which does, provide insurance and risk mitigation, if you want to call it. That's essentially what insurance is for high-risk projects, because a lot of these will be high-risk projects.
David, I promised you that was going to be the last question, and I'll honor my word. Thank you very much for what was really, I thought, an extremely informative discussion, though. And I know that many of our participants have valued this. There's still more questions out there, but I'm going to leave it to Suman and his colleagues at IDI, and they'll probably tap into your skills, David, to provide further responses. And I will now turn this back over to our friend Suman to wrap up. Thank you.
Thank you, Ambassador, and thank you, David. What a pleasure. This was one of the most interactive webinar I have attended or hosted. And we have at least 6 or 7 more questions, but we're not going to go over that. I will forward those questions from participants, they will not go unnoticed. So it will be on the way to David after the webinar, and we will respond the best way that we can. And I think I have email addresses of all of you, so it should not be that much problem. And what a pleasure. So if you have any more questions, anything, please send us an email. You'll all get an evaluation. Your rating on evaluation is very, very important for us. Now, we're not judging anything for David's knowledge or anything, but it just gives us a lot about webinar as we are learning, as we're going in this new world with technology. So you will get an evaluation about an hour after this webinar is over. And please respond to that, and we look forward to seeing you in future webinars. If there's any other topic interested that's going to interest you, please send us with your comments in the evaluation. So once again, David, Scott, and my colleague Roshan and Parshu and Nipa in the background, thank you very much, all of you. Thank you, and have a wonderful day.
Thank you.